Well, good afternoon, everyone. Thanks again for joining us today for this presentation on Clackamas County's area plan. My name is Brenda Durbin. I'm the Director of Clackamas County Social Services, and I'm so pleased to be here today and very grateful for your time and your interest in learning more about how Clackamas County supports older adults in our communities. I'll go ahead and share my slide. Can everyone see that okay? Great. So we are here to talk about the Clackamas County Area Plan. So just a little bit about social services. So social services serves as the area agency on aging for Clackamas County. This means that we are the recipients of some federal and state funds that allow us to support programs that allow older adults, and in some cases, younger people who experience a disability, to remain living independently in their community with choice and opportunities for social engagement. Social services provides direct services to older adults, and we also partner with 10 community centers, legal aid services, the State Oregon Department of Human Services, the Senior Citizens Council, and other county departments to do this important work. As we go through the presentation this afternoon, I encourage you all to either chat your question or make a note of that, and we will have some time for questions at the end of the presentation. Some of the programs that Clackamas County provides directly are the Aging and Disability Resource Connection. This is an information and referral system that allows anyone in the community to understand what services are available. This service is available via phone and also on the intranet. We provide programs to support family caregivers. We know that more than 90% of the caregiving that is done in this country is performed by unpaid family caregivers. These are our daughters, our sons, our wives, our husbands, primarily our family members who do this really important work. It is rewarding. It can also be very challenging. So this is a very important program that helps those of us who are caregivers continue to do that important work to support our loved ones. The money management program helps people who are on Social Security disability ensure that all of their basic bills are paid. Options counseling helps older adults learn more about the long-term services and supports that are available to them and helps them choose the best program and services that are going to meet their individual needs. Oregon Project Independence provides in-home and personal care support to allow people to remain living independently. SHIBA, the Senior Health Insurance Benefits Assistance Program, helps Medicare beneficiaries identify the best plan to meet their needs and also helps fight fraud and abuse in that system. Clackamas County has a wide range of transportation services ranging from volunteer drivers to fixed route service to neighborhood shuttles, all in the interest of helping people meet their basic needs, get to where they want to go, socialize, go to the doctor, all those important things. And then we also operate a Veterans Directed Care Program, which helps veterans fund their care needs through partnership with the Veterans Administration. Moving on to the important programs that are delivered by our community partners. That includes the home delivered meal program and congregate meals. So congregate meals are the opportunity for everyone to come together at their senior center to enjoy a meal and meet their neighbors. Information and referral is a service provided both by our community partners and by the county. Our community partners provide reassurance calls, case management. They do really important outreach to the community. Clackamas County is a very large county, and we are it's wonderful that we have our 10 senior center network, senior center partners, ranging from Welch's to Wilsonville to really help us connect with people wherever they live in Clackamas County. Our partners provide health promotion classes. We know how important physical and mental health is as we age. Respite for caregivers, guardianship, legal assistance, and transportation are some of the other programs offered by our community partners. So what is the area plan? So our federal funders require that every 4 years we create an action plan for aging services. The plan includes services, goals, and objectives for 6 required focus areas, plus additional couple of other areas that are really important for people in Clackamas County. The plan is really based on a comprehensive needs assessment that we do that includes surveys, focus groups, and listening sessions. We engage our Aging Services Advisory Council and a variety of community partners to analyze the data that we get through the needs assessment and help us develop the plan that we're going to be talking about today. And this plan will be officially adopted by the Board of County Commissioners by the end of March 2025. So what is in the area plan? It's a large document. There is a link to the document for those of you who want to read the entire thing. And there's a lot of great useful information in there. The first section is really about the mission and values of the organization, the population profile. Spoiler alert, older adults are the fastest growing cohort of residents in Clackamas County. The plan describes our programs and how we deliver those services. Shout out to our important community partners, and talks about the planning and assessment process that used to create this plan. The specific focus areas that you're going to see in the plan include information and referral, nutrition, health promotion, family caregiver support, legal assistance and elder protection, a specific focus on older Native Americans, behavioral health, transportation, and volunteering. And I'll go in a little bit more detail about all those areas a little bit later. So, what does the aging population in Clackamas County look like? Well, as of today, people age 65 and over represent nearly 20% of the county's population. That's nearly 80,000 residents. We are the fastest growing cohort, and by 2050, we expect that older adults will be a full 25% of the county's population. About 9% of older adults in Clackamas County identify as a person of color, and this is more than doubling the number of people of color in our survey in 2012. 7% speak a language other than English at their home. 31% live with at least one disability. 21% live in our rural areas, and 18% are working. This last point is particularly important. Over half of the older adult-headed households in Clackamas County do not make enough money to securely and comfortably meet their basic needs from month to month. And that comes from an in-depth analysis of something called ALICE, which is a way to measure what it really costs to live in any community. So what we heard from our survey, we had over 700 people respond to our survey, which is an all-time high. And then we supplement that survey information with focus groups and listening sessions for communities who maybe we didn't feel like we got enough response from during that survey. So we know that older adults are struggling to pay for their basic needs, as are many households in the community today. We know that access to transportation is an absolute key factor in allowing people to live where they want to live and go where they want to go. Clackamas County is large. We have an extensive transportation network, and there are gaps. In the survey, we asked people to describe what 3 areas would most improve their own quality of life. And the top 3 answers are home maintenance and repair, transportation, and opportunities to socialize. Well, we ask people to look forward about what they might want in the next 5 years. Again, we hear that people want help with home maintenance and remodeling and repair. A home that may served us really well during our younger years, maybe has stairs or some inaccessible areas, and that in order to remain living in our community of choice, that home needs some updating. We also heard that people would like help with house cleaning, and again, transportation, one of our top 3 responses. We know that certain sectors of our population experience social isolation at higher rates than others. Those include people who experience a disability, people who identify as a person of color, members of the LGBTQ plus community, and people with limited incomes. A little bit later in this presentation, I'm going to talk a little bit more about the impact of social isolation and what that means to both our physical and mental health, particularly as we age. So the area plan has a lot of goals and strategies, and we were able to summarize that into 4 major bullet points that really sort of describe what we're hoping to do in this plan. We want to increase awareness and the usage of available programs and services. We want to maintain and expand program capacity as much as possible because, as we know, there's going to be more older adults in a couple of years than there are today. We really want to increase participation among groups who have been historically underrepresented in our programs. One way we track this is we look at the program demographics from year to year and see how well our various outreach efforts are doing in terms of bringing more people into our communities, into our programs. And we always want to collaborate with community partners. We can't do this work alone. It takes us all working together to create the type of safety net and service delivery system that's going to meet all of our needs as we grow older. So what do we mean by strategic outreach? That can mean a lot of different things. In this context, it looks like, oh, excuse me. Okay. It looks like actively working with our partners across the department in the H3S, Health, Housing, and Human Services engagement work group. We want to send our staff out to culturally specific events, any fairs, community events, so we can get out of our offices and into the community, interact with individuals who are interested in learning more, and really give them the information that they need to decide if they want to participate in our programs. We're going to work with partners like OutFarm to engage with the Latinx community, and we're going to work with Native Americans to make sure that we understand the best way to get program information out to that important demographic. Increased participation, what does that look like? Well, at sort of a very sort of administrative level, it looks like training and supporting our community center. So we ensure that we collect complete information so we truly understand who is coming to our programs, who isn't, and that will help drive outreach opportunities. We'd like to compare our program demographic information to other census data so we can see how we're doing in terms of connecting with people as they show up in our census. And then we're always looking at data to identify which areas can need additional outreach so we can make sure that everyone who needs our programs understand how to access them, and once they access them, have a true sense of belonging. Community collaboration, a really important piece of the plan. We're going to personally invite representatives from Native American groups and other culturally specific organizations to our regular information referral networking meetings. We're going to convene quarterly meetings with community partners to share best practices and, again, attend a variety of different outreach and engagement activities. So this next section, I'm going to go a little more into the details. Again, you have access to the entire area plan where this information has a little more detail, but these are sort of some high level takeaways for you. So for our informational referral services, we want to increase community knowledge, understanding, and awareness of the Aging Services Network and the resources that are available. For our nutrition services, we want to increase food security. We all know how much the price increases of food is impacting everyone, particularly people who live with a fixed income. So our efforts around food security include both our senior focused programs, the home delivered meals and the congregate meals, but also ensuring that older adults understand that they are eligible for SNAP benefits, formerly known as food stamps, and that can be an important piece in ensuring that their nutritional needs are met. We all know that if we're not eating healthy, then that can impact many different factors of our life. And just one thing to note, all the meals that are served through our congregate and home delivered meals contain at least 1/3 of the recommended daily nutrition. So those home delivered and congregate meals are nutrient dense and are going to help a long way in addressing food insecurity. Health promotion. Um, Moving your body, connecting with people, all of that is a really important part of each of our own personal action plans as we grow older. So we have some funding from the federal government to help fund these programs, and we're required to use what we call evidence-based activities. So these are exercise regimes that have gone through significant review and study, so we know that they are effective. We really want to enhance and increase the availability of these programs because, again, they are so important for fighting chronic disease, helping people manage their diseases. And, most of them are done in a group setting, so it's a great way to meet your neighbors as well. I've already mentioned the importance of family caregiver. Our program serves both older adults, but also serves family members who are helping to support a younger family member who experienced a disability. Again, this is a critical program that provides both a little bit of financial assistance and also some support, referrals, other things that these family caregivers need. And we really want to expand that program significantly. Legal assistance. We have a fairly narrow list of legal activities that we can fund with these programs. Unfortunately, we cannot fund the development of wills, which we know is a big need among folks. But we do have a number of legal issues that we can be addressed. Through this funding, we also work to increase the awareness of elder abuse. So what we use is a program called the Gatekeeper Program. The Gatekeeper Program trains just everyday citizens, you and I, to understand the signs of abuse or self-neglect. So that might be a bank teller or someone who works at a grocery store. And what we really ask people to look at is any change. Is their appearance change? Are they a little unkempt? Are they maybe forgetting things? Are they withdrawing a large amount from their savings account? So through this Gatekeeper training program, we can help everyone identify the signs, and then very importantly, we help them understand what is the next step when you do have a concern about someone who you're interacting with in the community. Older Native Americans are one group that we're specifically mandated to support. We work regionally with our Tri-County partners to work with Native Americans, Native American serving organizations, and our partners at ODHS, Oregon Department of Human Services, employ tribal navigators. So that's an important touch point for us in terms of better serving older Native Americans. Older behavioral health is absolutely critical. Unfortunately, we know that over 50% of the suicides that happen in Clackamas County happen to people who are over the age of, I believe it is 55. So addressing social isolation and loneliness is one really important way where we can help lift up the behavioral health needs of all members of our community. So goals around this involve additional training and destigmatizing that request for help. And transportation. Again, transportation is a huge need. Clackamas County Social Services is well positioned to meet this need, and we have plans to even further expand what we're already doing in order to make sure that everyone can meet their basic needs and whenever possible, go out and socialize too. And finally, our last section is around volunteering. The volunteer programs that we do here at Clackamas County Social Services are very near and dear to my heart, and I like to call them the twofer. We could not have the service delivery that we have without the volunteers that we work with to really expand. We could not pay staff to do what the volunteers are doing. And we also know that by volunteering, that's a great way to reduce social isolation. When you wake up and you know that Mrs. Smith needs me to take her to the doctor next week, that's a reason to know that you are appreciated, that you matter, and that someone is relying to you. And we hear from our volunteers over and over again how meaningful their volunteer service is. We do an annual survey, and it's usually around 98% of the volunteers who work with us feel like their service is meaningful. So that is the end of my presentation. I'm going to click over to the last slide that gives you some information on how to view the area plan and contact information if you have any questions. So I'm going to keep this slide up for just a minute, and I'm going to ask Jennifer if we have any questions that came through in the chat.
We don't have any questions yet.
Okay. Well, everyone, this is your opportunity to ask your question. Hopefully, I have an answer for you. Everyone who attends today will also get a link to a survey. So the survey is another opportunity. We want to hear from you. What do you like about the plan? What do you think are the most important things about the plan? What is missing in our plan? There's also an opportunity for you to share your personal contact information if you want us to get back to you.
Okay, we have the question. ONA cuts hours for personal and direct service providers. How can you address it?
Okay, so if someone could please tell me what ONA stands for, there's a couple of different things that might be, so I want to make sure I understand what you're asking about. Is it the Oregon Nurses Association? Okay, so this is what I can tell you about direct service providers. So for our older adults program, our program called Oregon, okay, got it, eligibility process for people with DD. So let me talk about one thing, then I'll talk about the DD program. So for older adults, we operate the Oregon Project Independence Program, which provides personal care and home care to people who are older and have some needs. So the number of hours authorized in that program is capped and is based on the individual's need. I understand here that the question here is around our program that supports people with intellectual and developmental disabilities. So ONA in this situation stands for the Oregon Needs Assessment. So the Oregon Needs Assessment is something that the state has developed, and every year we go through each of our IDD clients, we talk with them, and we find out what their needs are. So this is a little bit outside of my area of expertise, but my understanding is that needs assessment is what determines how many hours each person gets. And I would encourage you to either connect with me offline or with your DD service coordinator if you have any additional questions about the Oregon Needs Assessment and how that interacts with the number of hours that are deemed eligible for each household or each individual. Jennifer, can you put my email in the chat, please, for everybody?
Yes.
I will say that I'm retiring at the end of this week. It has been an honor to do this work for Clackamas County. My successor, Tracy Garrell, is listening in on this webinar this afternoon. And if I'm not able to answer your question by the end of the week, please know that Tracy will be here to support you moving forward. Wait just a few more minutes to see if there are any additional questions. I guess one thing that I'll say is that this webinar has been recorded and is going to be posted on the various county social media and YouTubes. So if you know someone in your community who would like to hear this presentation, there will be a link sent out to the presentation and also a link to the full area plan and to that survey. Okay, well, with that, hearing no additional questions, I want to thank everyone for their attention today, for all the work that you do to support older adults in our community, and for your interest in learning more about this work. And if you're interested in further engagement, we do have an advisory council, and anyone who is interested in learning more, happy to contact me or Sean Wells, whose name was on that last slide, to learn more about opportunities to join the Aging Services Advisory Council for Clackamas County. So take care, everyone. Thanks again, and hope to see you soon.